Have you ever heard of a medical emergency that starts with a simple stomach ache but can quickly become life-threatening? Today, we're diving deep into a serious condition called AngiocholitiS, also known as acute cholangitis. It's essentially an infection of your bile ducts, the small tubes that carry bile from your liver to your gallbladder and small intestine. Understanding this condition is crucial because catching it early can literally save a life. What's behind this nasty infection? Usually, it kicks off with a blockage. Imagine a plumbing system getting clogged. That's what happens inside your body. The most common culprit is a gallstone that has escaped the gallbladder and gotten stuck in the common bile duct. Other causes can include narrowing of the ducts, which we call a stricture, perhaps after surgery, or even a tumor pressing on them. When the bile can't flow freely, it backs up and stagnates. This stagnant pool of bile becomes the perfect breeding ground for bacteria. This is the core of what angiocholitis is, a blockage leading to a bacterial infection. The resulting inflammation can cause serious problems, not just in the liver, but throughout the entire body if it's not treated quickly. So let's break down the pathophysiology, which is a fancy way of saying how it happens. First, you have an obstruction in the bile duct. As we mentioned, this is usually a gallstone. Because of this blockage, bile, which is normally sterile and flowing, backs up. This condition is called bile stasis. Think of it like a stagnant pond versus a flowing river. The stagnant pond is where things start to grow. Bacteria, which normally live in our intestines without causing trouble, can travel up into the bile ducts. The most common bacteria responsible for this are E. coli, Klebsiella, and Enterococcus. Once these bacteria get into the stagnant bile, they multiply rapidly, leading to a full-blown infection. The body's immune system responds by sending white blood cells to fight the infection, which causes inflammation and pus to build up inside the ducts. This increases the pressure within the biliary system even more. If this pressure gets too high, the infected bile can leak into the bloodstream, a terrifying condition called bacteremia. This is when the infection spreads throughout the body, leading to a systemic inflammatory response, or sepsis, which can cause organ failure and is incredibly dangerous. How do doctors recognize angiocolitis? There are classic signs that every medical professional is trained to look for. The first set of clues is known as Charcot's triad. It's a combination of 3 specific symptoms. First, there's right upper quadrant pain. This is a sharp, steady pain under your right rib cage, right where your liver is located. Second, there's a fever, often accompanied by chills and shaking, as the body fights off the infection. And third, there's jaundice. This is a yellowing of the skin and the whites of the eyes, caused by the buildup of bilirubin, a substance in bile that can't be drained properly. If a patient presents with these 3 symptoms, angiocolitis is high on the list of possibilities. However, if the infection is particularly severe, 2 more signs can appear, creating what's known as Reynolds Pennet. In addition to the triad, the patient will experience hypotension, which is a dangerous drop in blood pressure, indicating shock. The fifth sign is altered mental status, like confusion or extreme lethargy. Reynolds pentad signals a very severe, life-threatening infection that requires immediate, aggressive medical intervention. It's a true medical emergency. To standardize the diagnosis and treatment of this condition, experts from around the world developed the Tokyo Guidelines. The most recent version, from 2018, provides a clear framework for doctors. The diagnosis is based on a combination of three key areas. First, are there systemic signs of inflammation? This is confirmed by a fever or lab tests showing an elevated white blood cell count. Second, are there signs of cholestasis? This means the flow of bile is impaired. This is shown by jaundice or abnormal liver function tests. And third, is there imaging evidence? This involves using scans to actually see the problem, like a dilated bile duct or the cause of the obstruction itself, like a gallstone. A definitive diagnosis is made when a patient has evidence from all three categories. The Tokyo Guidelines also help doctors grade the severity of the angiocolitis. Grade 1 is mild, where the patient responds well to initial treatment. Grade 2 is moderate, where the patient isn't responding as quickly and may have other risk factors. Grade 3 is severe, and this is where we see organ dysfunction, like the hypotension and confusion from Reynolds pentad. This grading system is vital because it helps doctors decide how urgently and aggressively they need to act to save the patient's life. When a patient arrives at the hospital with suspected angiocolitis, the medical team springs into action with a series of investigations to confirm the diagnosis and plan the treatment. It all starts with blood tests. A complete blood count will almost always show a high white blood cell count, a clear sign of infection. C-reactive protein, or CRP, another marker for inflammation, will also be elevated. Liver function tests are crucial. They'll show high levels of bilirubin, which causes jaundice, as well as elevated liver enzymes like ALP and GGT, confirming that the bile ducts are blocked. Blood cultures may also be taken to identify the specific bacteria causing the infection and guide antibiotic choices. Next up is imaging. The first-line imaging test is usually an abdominal ultrasound. It's quick, non-invasive, and can often show dilated bile ducts or even the gallstone causing the blockage. If the ultrasound isn't clear, a CT scan or an MRI can provide more detailed pictures of the liver and biliary system. The gold standard for both diagnosing and treating the obstruction is a procedure called ERCP, which stands for endoscopic retrograde cholangiopancreatra. During an ERCP, a doctor uses a flexible tube with a camera to go through the mouth, down the esophagus, and into the small intestine to directly visualize the opening of the bile duct. They can inject dye to see the blockage on an X-ray, and, most importantly, they can often remove the stone or place a stent to open the duct right then and there. So, how is angiocolitis treated? The moment it's suspected, the patient is admitted to the hospital. This is not something that can be managed at home. The first priorities are to stabilize the patient and fight the infection. This involves several steps happening all at once. The patient is made nil by mouth, meaning no food or drink, to rest the digestive system. They are immediately started on intravenous fluids to rehydrate them and support their blood pressure. Broad-spectrum intravenous antibiotics are given right away to start fighting the bacteria that have spread into the bloodstream. These are powerful antibiotics that cover the most likely culprits like E. coli and Klebsiella. While the antibiotics fight the infection, the root of the problem, the blockage, must be addressed. This is called biliary drainage. As we discussed, ERCP is often the preferred method. A gastroenterologist can perform a procedure called a sphincterotomy to widen the opening of the bile duct and then use a small basket or balloon to pull out the offending gallstone. If a stone can't be removed, a small plastic or metal tube called a stent can be placed to hold the duct open and allow bile to drain. In very sick patients, or if ERCP is not possible, a radiologist might perform a percutaneous drainage, where a needle is inserted through the skin into the liver to place a drainage tube directly into the bile ducts. Throughout all this, the patient is monitored very closely, with frequent checks of their vital signs and repeat lab tests to ensure they are responding to treatment. To wrap things up, let's do a quick recap. Angiocholitiis is a serious and potentially fatal bacterial infection of the bile ducts, usually caused by a blockage from a gallstone. The classic warning signs are Charcot's triad, right upper quadrant pain, fever, and jaundice. If it progresses, it can lead to Reynolds pentad, which adds low blood pressure and confusion, signaling a life-threatening emergency. Diagnosis is confirmed with blood tests showing infection and liver problems, along with imaging like an ultrasound or CT scan. The Tokyo guidelines help doctors classify the severity and guide treatment. Treatment is a medical emergency that requires hospitalization for antibiotics and, most critically, draining the blocked bile duct, often through a procedure called ERCP. The key takeaway from all of this is that early recognition and treatment are absolutely vital. If you or someone you know ever experiences that combination of severe abdominal pain, fever, and yellowing skin, it is crucial to seek emergency medical help immediately. Delays can lead to sepsis and organ failure. After recovery, it's also important to follow up with your doctor to manage the underlying cause, which often means having surgery to remove the gallbladder to prevent future episodes. Angiocholitis is a perfect example of why listening to your body's warning signs and acting fast can make all the difference. Thank you for watching. If you found this video helpful, please give it a thumbs up and subscribe for more medical education content. Stay safe and stay informed.